The news on Mississippi's highest daily death toll. Health officials say the state is on track to surpass 1,000 COVID-19 deaths this month. State Health Officer Dr. Thomas Dobbs said in a press conference today that COVID-19 is one of the leading causes of death in Mississippi, a record day that was unfortunately expected. The health department is already talking with hospitals across the state about activating the crisis standard of care plan. Basically, that means to get care, patients would be triaged, and as the number of nurses decreases, staffing changes would have to be made. Dobbs says the healthcare system in the state is overwhelmed right now. Health leaders expect another large surge of patients after Christmas and New Year's.
We have ERs that can't be ERs, so people don't have access to emergency room care because they're full of COVID ICU patients. We have ICU beds across the state that have 2 persons in a bed that's made for 1 person. These are things that are happening now. Let me just be frank with you guys. It is bad and it's getting worse. It's exactly what we anticipated. It's not rocket science to look at the numbers and understand the modeling of what's going to happen. We did some modeling and predicted that over the next few weeks, we'll see well over 400 or even close to 600 ICU patients in need of care. Now, the challenge is we can't take care of that many people, so a lot of them are not going to make it. And they're not going to make it because they don't have access to care. And this isn't just COVID patients. It's also non-COVID patients. It's people with heart attacks, it's strokes, car wrecks.
Mississippi has received more than 62,000 vaccines for frontline workers in hospitals. Another 12,000 will go to long-term care facilities.